Welcome back. I'm Michael Schuler. We're videoing a new video on how scheduling occurs. And so you can see we're in front of our board here today. We've got two surgeons operating, one myself, one another surgeon. As you might hear with regards to people asking, hey, when's my surgery going to be? We typically let people know the day before around noon or in the afternoon, and that's because it's always a constant flow trying to figure out the best way to get these things scheduled. We get people all the time complaining about, for example, I was told to be here at 8 o'clock and now it's 10 o'clock. What cases are the one cases that actually start when they're told they're going to start?
First case of the day. That's it.
So after that, it all depends on how the case goes. Some cases might run long, some cases might run short. And so again, you're told a certain time that is not an actual time for your surgery. Typically kids and diabetics go first. And so again, we've got an 8-year-old here as my first case. Dr. Johnson has a diabetic as well. Reason we do kids and diabetics first, we have to be NPO, which means you don't eat or drink anything. And so diabetics can lose control of their blood sugars if they're not eating or drinking, and then kids typically don't do well with not eating or drinking. So other than that, tell us a little bit about the board. I noticed there's a lot of L's and a lot of R's lined up.
Yeah, so a big factor in when you get your surgical time or when you go back is we have the two surgeons here, we only have 3 ORs, so they have to essentially take turns flipping rooms to progress their day along. So if you look, Dr. Johnson's mainly over here, Dr. Schuler over here, however, there's points where they're taking turns and you're going from a hand to a foot case. So that can slow down turnover time as far as your surgical time moving a little bit throughout the day. We try to keep the lefts in one room, rights in one room, but sometimes that's not possible. If we go from a left side to a right side, all of the equipment that was on the left side has to then be moved to the right side. We have things like x-ray, suction, towers that he operates with cameras. All those things have to be moved around the OR as well as it being properly cleaned. So that can kind of adjust the surgical flow and time during the day.
So, for example, this says carpal tunnel. Is that a problem if you have multiple cases that are all the same case, one after the other?
Yes, that's another factor because we use the same trays for those. These trays, we only have a certain number, so these have to be turned over between each case. So you run into an instrumentation issue. You have to clean, sterilize, and turn over those trays for instruments that we use for similar cases. So that, again, is another thing that has to be done before we can move on to each case to case.
And remember guys, if you haven't already, please hit the subscribe button. You mentioned flipping. Tell me what flipping in a room means.
So flipping in a room is while Dr. Schuler and his assistant is finishing closing, the nurse is helping recover the patient. He can then go to the next room and get ready and get going for the next case. Again, that helps with surgical flow time to keep you in and out of here as much as we can. So that's why it's nice to take turns with these doctors getting a flip room. They share that. While
we're closing, they can start to go back with the next patient, so I can walk directly into the next room and go ahead and start the next case. Otherwise, we have to go, they have to take the patient out, they have to clean the room, clean the instruments, change over any of the bedding, and then bring the next patient back. And so that obviously takes time, and so that stuff can be being done while you're operating in the other room on the next patient. And so flipping can really speed things up, but we don't always get that luxury, do we?
No. So behind the scenes, Dr. Schuler is just bouncing around doing your surgery, and there's about 10 people who are just working as hard as we can to get your surgery ready, get the rooms ready for him to show up and do his best work.
So the other thing is, you're having surgery that day, don't get angry if it's running behind. I promise you, we're not playing golf, we're not playing cards. It really is something where it's a team effort where everybody tries to get together and get the work done as quickly as possible so that everybody gets their surgery done quickly as well as getting to go home. All right, so let's go into the room. We'll show you what an OR room looks like when it's set up. So again, you can see this is our OR table. This room set up for left hand. We're not planning on using any cameras, so the screen's over to the back. If we're gonna use a camera and we're switching left to right, you gotta switch the bed, you gotta switch the cameras, you gotta switch all those instrumentation. Same thing if we've got x-rays in there. So all that stuff takes time. And again, the most important thing is efficiency. So the sooner we can get through the cases, the sooner everybody can go home and everybody gets their surgery done. If you like this video, click our profile above or tap our latest video to see what's next. Thanks for watching.